Good afternoon, everybody. Today is August 20th, 2021. My name is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Our website is falmouthma.gov. I put the most updated COVID, the basic stuff that you might want to see. This presentation also goes on it up on the website. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So starting today, we're at 1,669 cases since the beginning. That means 19 confirmed cases during the 7-day period that just ended. I end these on Thursdays. 9 probable cases this week. Most people are in isolation. Falmouth is about 11.1 of all cases, and our percent positivity for the week is down to 2.25 from 2.62. You see our weekly case trend. We've had about 4 weeks where we've been around 20 cases per week of confirmed cases, and we've been averaging 7 or 8 or so probable cases. So if you add them up, it's somewhere in the mid-30s, upper 30s per week for the last 4 weeks. So that's where we've been. If you see down the chart, we had a very good June. Delta kind of kicked in second week of July, and you can see where the cases have gone up, but they seem to be right around, in terms of confirmed, right around 20 cases per week. This chart just shows that the curve had been pretty flat. It's gone up a bit, but it's not gone up like you would have seen back in that sort of December through February range where we had a steady, very sustained increase in cases. So it's on the flatter side. It's on the, somewhat stable, at least for the last 4 weeks. Who knows what's going to happen in the future, but that's where we're at. In terms of Barnstable, similar in Barnstable, it's had that, the entire county. The entire county's had that increase, and it's sort of stable right around the 100 to 150 cases per every 3-day period. So in terms of hospitalizations, Falmouth this week, this last check on the 17th had 3. We were right around 1. Not to a point where I think there's 10 ICU beds at Falmouth Hospital, somewhere around there. There's no ICU patients and 3 in the hospital. So it is an increase, not an increase that the hospitals I think can't handle. You see 7 at Cape Cod Hospital and 3. Increase of cases. You will have some increased hospitalizations. Not everybody's vaccinated. And occasionally when we talk about third doses in a little bit, you'll see that some people with immune compromise or in a position where the vaccine maybe didn't take quite as hold could land them in the hospital. So you do see a slight increase from the 5th to 10, but not something where the hospital isn't able to manage at this point. In terms of the state is about right around 1,300 cases over the last few days per day. Hospitalizations are up to 439 with 94 patients in the ICU. 48 are intubated throughout the state. It looks at how they're doing trend-wise. You can see the cases have sort of maybe stabilized a little bit in the state. The positivity seems to have stabilized in the high 2s, not stabilized like for a long term, but in the last week or two. Hospitalizations have kicked up a bit. You can see that sort of trending upward. There's a little bit of a delay with cases in when they land up in the hospital. You do see some of an increase. Death-wise, you do see it relatively flat on a low end. Again, the vaccines are effective in preventing serious disease, even with Delta around, but there is vaccine breakthrough, therefore that's why we've been in that sort of around 1,000 or so cases per day throughout the state. For the county, this is a 14-day incidence rate, daily incidence rate. Provincetown has definitely come down. The surrounding communities, there's been cases in the surrounding communities, and so the Outer Cape has had this sort of higher level of cases based on what happened in Provincetown in mid to late July, and that'll take a little bit of time to come down. If you look at the Mid Cape and Upper Cape, you see the incidence rates on the lower end, with Falmouth at 8.2 per 100,000 as a daily incidence rate. And so you see much of the Mid Cape and Upper Cape hasn't seen what has been seen in the Outer Cape. If you remember in the spring, you saw of a Mid Cape blow up, which did eventually work its way to Falmouth, but we're not seeing that as that Outer Cape increase in cases working its way towards Falmouth. As far as vaccinations go, we had a 1% increase, so it's 71% of individuals are fully vaccinated in the county. Looking at Falmouth's vaccination rates, we're making slight gains. We're averaging, it was closer to 200 last week. We're at 117 new vaccinations, 93 second dose vaccinations. You can see that we're at 78% of all eligible residents are fully vaccinated, 71% of the entire population, because there's a percentage of population that's not eligible yet. Most of our gains have been in the younger group. I think people that have wanted it and been able to get it, over the age of, let's say, 60, have gotten it. I mean, looks like you did see somewhat of an increase, slight increase among the 65 to 74-year-olds that ticked us over to the 1% increase. But by and large, over the last few of these that I put up every week, you see most of the gains in the under the 50 category. But that's where we are with our vaccination rate. It's still better than most. It's high. Barnstable counties in the islands are the highest in the state, and the state's on the very high end of national vaccines, by state vaccination rates. Vaccine availability, again, you go to vaxfinder.mass.gov. If you're homebound, you can call the health department. We used the community health center earlier on. Now, as we got through that initial wave or push of people who needed it, now the maintenance base, we've been using the VNA. You can call us at the health department if you truly homebound, and we can make arrangements. Testing is still the same. You've got Convenient MD, you've got the CVSs, the private sector, you've got the hospital doing it through your physician. We're going to have some testing at the fairgrounds again, starting on Sunday the 22nd, run on Thursdays and Sundays from 4 to 6. You can go through Barnstable County Health's website, and you can also do walk-ins. Okay, so it's a drive-through system. And as the fairgrounds winds down, maybe we would increase the frequency, but right now we're doing it on Sundays, and the county is working with the Medical Reserve Corps, so the volunteers will be out there 4 to 6 on Sundays and on Thursdays. As far as third doses of vaccine, this is from the CDC website. They're recommending those are immune compromised. Moderately to severely immune compromised should receive an additional dose of the mRNA. This is for mRNA. Those are the Pfizers and the Modernas. It's not clear yet what the CDC is going to say for those that receive the Johnson & Johnson. But right now, the mRNA ones, the third dose of vaccine, that just recently came out for those with immune compromised. They're not recommending it for the entire population at this time. Talk to your healthcare provider whether you should get a third dose. The county, the clinics, the vaccination clinics that we've been running will be, we're working on, getting it set up so we can help accommodate this. Right now, you could just go on the Vax Finder. It'll be mainly pharmacies. You'll start seeing some clinics opening up. And also, the county does one every week. You can go on the Barnstable County website. They do one at Barnstable County's complex, which is where the courts are, up on 6A. That's one place that we do a clinic every week. But as the demand's going to go for third doses, we'll increase the number of clinics that we have, and we'll post them as we did last time. And so pay attention if you fall into this category. As far as face coverings, we still have a mask advisory. The state has so we did that after the guidance left. The school committee will vote next week. The CDC does recommend face coverings. The school committee will vote on it next week. They had an open forum this week to discuss what they're going to do from the school. The CDC says all unvaccinated obviously should wear masks. Vaccinated people should wear masks in indoor areas of substantial or high transmission, low vaccination rates, or stressed healthcare capacity. If you look at Falmouth, we're in the low infection rate. We have a 14-day daily incidence rate of 8.2, which is in the low. Percent positivity is at well less than 5. Our hospitals, even with 3, are not at a stressed healthcare system, and our vaccination rates are high. So at this point, vaccinated people are not, we don't have a vaccine mandate for the public at this point. I've had people who want that. I've had people who don't want that send us emails. But we're using, and the Board of Health met this past week as our routine meeting. We did discuss this, and it seems this might be the way we're going to go, at least for now, in terms of the general mask mandates versus an advisory. We are advising you all to wear masks indoors, but whether we're going to require it, I think is going to be based on the science and based on these sort of metrics. Again, as a recap, all guidance has expired, so there's no guidance going on. There's a vaccine eligibility, again, anybody over 12. Falmouth resident vaccine rates similar to other Cape towns. We're doing well that way. Third doses are being recommended for the CDC for the immune compromised. We haven't heard from the state on it yet. Perhaps we'll hear some more information about how that's going to roll out here in Massachusetts. We don't have that information yet. Like I had said for the last few meetings, since about early July, Delta variant is your dominant strain. It is more transmissible. Vaccine breakthrough does occur. I do get that question. It does occur, but it does appear that the vaccine is highly effective in keeping you out of the hospital and severely ill. In terms of cases, Falmouth has been a similar case count pattern for the last 4 weeks, right around that 20 to 30 range. So, again, as a recap, keep an eye out if you're immune compromised for that. It may be further information on the third dose. The school committee will vote whether they want a mask mandate in schools, and our case count's been pretty stable, at least for the last 4 weeks. So that's my update for the week, and I'll see everybody next Friday. Thanks.